just a little bit about me. I've recently CCT'd. I was in the Northumbria GP training program, mostly around the Newcastle area, but it does cover like a wide part of the Northeast. Um, and I'm here to just give a bit about my experience with preparing for the SCA and the role that I got, that MTS provided that was very helpful. Uh, Firstly, if we want to talk about preparing for the SCA in general, there are a few things that is fairly universal, which is getting enough experience, seeing enough patients and things. I did for myself notice, for example, when dealing with COPD patients, after I actually saw COPD patients in clinic, it became much more comfortable for me to deal with them on exam situations. So one aspect would be definitely uh, to make sure to try and write it, to try and do the essay at a time that is reasonable, like that you've gotten enough clinic time. There is a feedback that I was getting from different supervisors that comes with a caveat when it comes to getting experience. I try to take time off to study for the SCA, and I think that's a good thing to do. And sometimes I'll get pushback from different people saying the advice we get is that clinic experience is the most valuable thing, getting more experience with the patients is the most valuable thing. Um, and sometimes they don't like it, don't like people to take time off to prepare. They think it's counterintuitive. And that, I would say, that is useful to a point. So as the thing I've just mentioned, where you get the experience in the different types of patients. For example, I didn't get to see palliative care patients until ST3, where so dealing with these kind of patients on the exam, it's a lot more theoretical. So I would agree with this thing that the schools tend to give, where you need experience to the point where you see the variety, but you do need to sit and practice, and it would be useful also to take some time off to practice for that. And when it comes to preparing for it, there's two aspects. There's the knowledge and experience aspect, and then there's the actual um, performance aspect, like where you're applying the knowledge in the way that the examiners like. So I've done different things, different ways for preparing knowledge-wise. Firstly, getting experience in the clinics, actual uh, patients, preparing for the AKT, and then other courses where they go through everything as well, through basically all the course material. But there is something additional that Imtiyaz gives, is they have a well-rounded approach. They can do the full course things. But I can only speak about my experience, which was really good on three aspects. I did the compressed course. I'm not sure if there's a different name for it. Um, the fast track, the compressed course, and I did the mocks. Um, and the things that are gone through the courses, like they are relevant to the exam. And there is, I would say, to take the compressed course after you're already familiar with the full material. So if this is the first time you're going through all the material, all the different topics, all the different domains and topics, then the compressed course is too dense. But if you've already done it and now you've already revised these things, and you want to revise them one more time before going to the exam and get some really good tips on how to approach it, then taking this dense compressed course is good, because you're not gonna have to try and retain everything, and you can focus on relevant to the exam. Uh, if you retain all the information, is to give yourself time to take the longer course. The This is all from the theoretical side. From the mock side, from practicing with friends and things like that, it's very important to get feedback. try and get different people, different types of colleagues to study with, and don't try and be too nice with each other with the feedback, because in the end you want to do well in the exam. You want to know where you need to improve, and you want to help your friend to know where they need to improve. With the mocks, usually when we're studying with colleagues, it's with other medical people, and this has its advantage where they can help you out with things, but also when you're actually doing the exam, the disadvantage is the patient actors, simulated patients are not medical, and they do tend to act differently. So this is kind of an advantage we have with the big mock that I noticed with when I did it at this academy. Basically, the big mock has six stations that you're going through one after the other, and they are paid actors and not medical. So the interaction I noticed was different, and it's a bit more real. And you get, if I remember correctly, you get feedback uh, on each thing that you did, detailed feedback in a few days. The There's the only you mock. This is you doing six stations with one or two other simulated patients, but they are medical. The advantage here is that you get the feedback right away. So the other one, the advantage is you get more um, you get more like exam condition because it's the right type of patients and things. A bit of disadvantage is sometimes you can't recall exactly what you did, so you're trying to you get it in the feedback and you're trying to recall where I did this in the feedback. With the only you mock, it's again like with colleagues because it's all medical, but you get feedback right away. And the feedback that I've received, they give it in an Excel sheet, and it's exactly what you need. And I would say until until it's shown on the feedbacks you're doing. I did so many of these mocks, by the way. I was doing like one by the months. I was doing one like every 10 days. But I've been studying for a while. I've had to repeat the exam, and this was like an all-in thing for me. So I really invested, and Imtiyaz like really helped me pass this time. So it was really good. Until you see that the mocks you're getting feedback that you like that's another tip I would give. Wait for the exam. Like don't write it unless you're okay to write it again or something until you get the feedback that you like from them. Because another aspect is as like it's hard to perform your best during the exam condition. So you try to even aim a bit better. And this was something I found is that they pushed me to that top. They were like, you can be a bit nitpicky, but you need to be at the absolute best because you're not going to be at your best on the exam. It's a little more nervous. There's a little more technical problems. Um, so what made the biggest difference for me overall, there were so many strategies to preparing for this, but what made the biggest difference is knowing when I can write it. Because even if you're doing the wrong things, you can get there slowly, you can get there slower than others, as long as you don't write it until you're getting the proper feedback that you need. And they do give, like, you will see from the detailed feedback in the Excel sheets, everything that was really good and everything that needs improvement. And you pick up patterns, and when you have it all written down, it's easier to see these patterns. So that's like the take home in the end is wait till you get an approval seal. They won't give it to you like but you can pick it up when you see the feedback, and and you can ask them. I was a bit cheeky, and I asked, can I write it now, and things. So try and do that.
Right.
If
Thank
anyone
you.
has any questions, feel free to let me to ask.
Thank you. Dr. Yusuf, you already relocated to Canada, right? You went back to Canada.
Yes, yeah.
Right. So you just like you did fly quite soon after your CCT, after your exam
Yeah,
actually.
I CCT'd on like April 11th, and I took the flight April 30th. I I I don't know. I had like a card that I just sold for a little less so that I can sell it quickly. But yeah, I've uploaded documents and things, and the process is going okay.
Right.